I thank the senator. The first comment I would have is relying on what a Wall Street analyst says today. They have about this much credibility in this country today. Look at the economic situation we find ourselves in because of what Wall Street analysts have said. That's the first point I would make. The second point is the majority whip yesterday said we should not cut Medicare. We should cut Medicare Advantage because of the 14%. Senator Dodd just recently went after the Patient's Choice Act because we actually make it be competitively bid without any reduction in benefits. Your bill, for every Medicare Advantage, cuts 50% of the benefits out. It cuts the benefits. And so the difference is, and I agree with the majority whip, we do need to have the savings in Medicare Advantage. But the way you get that is through competitively bidding it at the same time maintaining the requirements for the benefits that are offered. There's a big difference in those two. Ours ends up being pure savings to save Medicare. The savings in this bill are to create a new entitlement. The other point I'd make, if you're a senior out there listening, and if you're going to be subject to the new increase in Medicare tax, for the first time in history, we're going to take Medicare taxes and not use it for Medicare. We're going to use it for something else. Under this bill, this 0.5% is now going to be consumed in something outside of Medicare. So no longer do we have a Medicare tax for the Medicare Trust Fund. We have a Medicare tax that funds the Medicare Trust Fund plus other programs. I would say to my colleagues, I think we want a lot of the same things. How we go about it. The senator from Montana recognized the fact that we're going to increase payments to primary care physicians. Ask yourself the question, why only 1 in 50 doctors last year who graduated from medical school is going into primary care? Why do you think that is? Could it be that the government who is setting the payment rates created a maldistribution in remuneration to primary care physicians, therefore they choose to go where they can make 200% more over their lifetime by spending 1 additional year in residency rather than doing primary care? And what this bill does, and what the senator from Arizona is trying to do by sending this bill back, is to refocus us on the fact that Medicare money ought to be used for Medicare. And if, in fact, we're going to slow the growth of Medicare, can we do that without cutting benefits? And to slow the growth in this bill for 11 million Americans who now have Medicare Advantage, you will diminish their benefits. That's out of the $120 billion that's going to come. You can't tell a senior who's in a rural area today, who is on the economic lower rungs of the ladder, who uses Medicare Advantage to equalize their care with somebody who can afford a Medicare supplemental policy. You can't tell them that this is not going to decrease their benefits and decrease their care, because it is. And in the bill, it actually states that it's going to decrease their benefits.
I'd also very briefly, the senator from Montana talked about the support that it gets. AARP makes more money from Medicap plans than they sell to seniors. AARP should be opposing the bill, but other senior groups like 60 Plus are educating seniors. The AMA endorsement of the bill, shocking. The bill puts the government in charge, but AMA cut a deal to get their Medicare payments addressed by increasing the deficit by $250 billion. And pharma, my God, if there's ever an obscene alliance, the agreement that's been made that would harm seniors because it prohibits, it has the administration against drug reimportation from Canada and competition for treatment of Medicare. So now we understand a little bit better why these special interest groups, 500 and some of them, have visited the White House in recent months, according to White House logs.
The senator would probably be interested to know, and I know my colleagues on the other side, the American Medical Association now represents less than 10% of the actively practicing physicians in this country. The physicians as a whole in this country are adamantly opposed to this bill. And the reason they're opposed to this bill is because you are inserting the government between them and their patient. That's why they're opposed to this bill. So you have the endorsement of the AMA, which represents less than 10% of the practicing doctors, actively practicing doctors in this country, because not only will it increase payments, but CPT code revenue is protected. That's the revenue that this AMA gathers from the payment system that continues to be fostered in this bill, which is their main source of revenue.
Could I